I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is a continuing medical education program, a health awareness program for the public, organized by Padma Clinic and Nursing Home, Chennai. Today's topic is on the facets of epilepsy, of which part 1, 2, 3, 4, 5, 6 I have already spoken. This is on part 7. This is concentrating on epilepsy and driving. Many a patient who suffer with epilepsy do ask one question to me: can I drive my car? Or rather, when can I drive my two-wheeler or car? Or when can I ride a bicycle? Now, this is a common question that's being asked, especially driving a car and driving a two-wheeler. One has got to be very, very careful. Now, what does the law states? The Motor Vehicle Act 1939 of India empowered the transport authorities to deny driving license to anyone, even with a single seizure at any point in his life. So, therefore, the current regulations require that all applicants fill up an application cum declaration, the physical witness form, and the doctor should examine him in detail, and if epilepsy is being mentioned, he is denied a license. That is exactly the law that states. But the Indian Epilepsy Association has been addressing all these issues, and they in fact put some suggestions to the government, especially the Minister for Surface Transport in 2005. The suggestions are with regard to issue of driving license to people with epilepsy. Now, subject to certain conditions, one can issue, like the license should be issued to those who have not suffered epilepsy attack in the last 1 to 2 years. That is one suggestion put forth to the government. In general interest of the public, the license should not be issued to people with epilepsy who may want to be drivers of public transport vehicles and heavy vehicles. That's another suggestion that has been put. Yet another suggestion is you should make it mandatory for the person to inform the appropriate authority if they develop a seizure. The doctor in charge of the person with epilepsy should inform the appropriate authority immediately, and all doctors should have a copy of these guidelines. Now, according to these recommendations, the Indian Epilepsy Association said driving license can be issued provided they have a fit-free, they are free from any form of fits at least for 3 years, which should be certified by a doctor along with a EEG. Now, these were the recommendations, but these recommendations are still pending actually. No decision has been taken, but as of today, the Government of India has no provision to issue driving license to people with epilepsy, no matter how long they have been seizure free. Now, let us look at the international outlook, what's happening in US, what's happening in UK, and what's happening in other parts of the world. In the last 10 years, the Morris Parsonage Commission on Driving License Regulations of the International Bureau for Epilepsy, IBE, it's an international body, has given a set of recommendations after studying the subject extensively. It has suggested that a limited restriction for a period of 2 years following a seizure is adequate, and the period thereafter should be considered risk-free for issuing a driving license, provided the seizures are well controlled. And if you look in USA, they permit a person to drive if he or she has been seizure free for a period ranging from 3 and 18 months. In UK, a driving license can be granted if the person has been free from seizures for 1 year. In Australia, the driving licenses are issued to those who have been seizure free for a period of 6 months to 2 years. Usually, such driving licenses are always with certain conditions. That's very, very important. But as things stand today, the Indian law is that, or the Motor Vehicle Act is such that if the person has seizures, then he will not be issued a driving license. So that's it. That's in brief on can I drive, the answer to the question on can I drive, especially an epileptic person or a person suffering with epilepsy. When he asks a question, can I drive a car, can I drive a two-wheeler, I think this is the answer. Thank you very much.